In a study, I know you guys have heard of observational and study experiments in science in the past, so let's go ahead and review the definitions of what an observational study is and what an experiment is. So, in an observational study, researchers determine whether an existing condition or a factor in a population is related to a characteristic of interest. In an experiment, researchers create a condition by imposing a treatment on some of the subjects of the experiment. So, generally, an experiment is preferred over an observational study because an experiment allows researchers to manipulate one variable to see if it has an effect on another. However, there may be practical or unethical reasons against performing an experiment. Okay, so now we are going to look at a couple of studies and determine whether it is observational or an experiment. We're going to identify the factor if it is an observational study or if it is a treatment in an experiment. Then we are going to identify the characteristic of interest. So for A, researchers measure the cholesterol of 50 subjects who report that they eat fish regularly and 50 subjects who report that they do not eat fish regularly. So when you think about this, right, we're measuring cholesterol of 50 subjects, and these people eat fish regularly. And then we have 50 who do not eat fish regularly. So in this case, because we are not controlling anything, this would simply be an observational study. The factor that we are looking at, or what we are measuring, is whether people eat fish regularly. And the characteristic of interest in this case would be the cholesterol level. So does eating fish affect cholesterol or not? Okay. For B, researchers have 100 subjects with high cholesterol take fish oil pills daily for 2 months. They monitor the cholesterol of that subject during the time. So when you think about this, they're making people with high cholesterol take the fish oil pills, right? They're controlling that variable. So in this case, this would be an experiment. The treatment, because it is an experiment, is taking fish oil pills daily, and the characteristic of interest is cholesterol level. All right, so now I want you guys to try C, okay? Hit the pause button and come back and check your answer when you're done. All right, so for C, you should have that this is an observational study, right? We're just seeing the driving habits of 80 subjects in their 20s and 80 subjects in their 50s. We can't control them, we can simply observe them. The factor in this case would be a person's age, right? And what we are looking at, our characteristic of interest, would be the person's driving habits. So when you think about this type of study, right, it's not something we can control. We want to see or we want to determine how people drive and if there's a relationship between their age and their driving habits, right? Would people be better drivers in their 20s or in their 50s? Okay. Now, identifying the differences between observational studies and experiments is pretty simple, right? You have to determine, are they watching, are they looking for something, or are they manipulating a variable, okay? When we are working with experiments, we have two different types of groups which we use, okay? Whether a study is observational or experimental, it should be comparative in order to establish a connection between the factor or treatment and the characteristic of interest. Remember, when it is an observational study, we have a factor. When it is an experiment, we have a treatment. And both of them have a characteristic of interest, which is what it measures or what it attempts to measure. For instance, determining the rate of car accidents among people who talk on cell phones while driving is not instructive unless you compare it with the rate of car accidents among people who don't talk on cell phones while driving and find that it is significantly different. While a comparative observational study can suggest a relationship between two variables, it cannot establish a cause and effect relationship because there can be confounding variables, also called lurking variables, that influence the results. For instance, perhaps people who talk on cell phones while driving are more likely to drive aggressively. So it is the aggressive driving and not the cell phone use that leads to a higher rate of car accidents. In an experiment, randomization can remove the problem of a confounding variable by distributing the variable among the groups being compared so that its influence on the group is more or less equal. Therefore, the best way to establish a cause and effect relationship between two variables is through a randomized comparative experiment where subjects are randomly divided into two groups: the treatment group, which is given the treatment, and the control group, which is not. Okay, so for this example, we are going to look at a couple of different scenarios, and we are going to identify the treatment, the characteristic of interest, the control group, and the treatment group for the given experiment. Assume all subjects of the research are selected randomly. Okay, let's look at A. To see whether zinc has an effect on the duration of a cold, researchers have half of the subjects take tablets containing zinc at the onset of cold symptoms, and the other half take tablets without any zinc. The durations of the colds are then recorded. So when we think about the treatment, right, you have to think about what it is that is being provided. What are we seeing or checking for a cause and effect relationship? In this case, the treatment would be having subjects take tablets that contain zinc. How do we know it's zinc? Because the researchers are trying to determine whether zinc has an effect on a cold. So the characteristic of interest would be the duration of a cold, right? And how do we know that? Because what's being measured, what's being recorded is the duration of the cold. So if the group that takes tablets with zinc has a shorter cold period than the group that takes tablets without zinc that has a longer cold period, then we know that that zinc is being effective as a treatment. So the control group would be the subjects who took tablets without zinc, right? Remember, we don't want to change the behavior of their cold per se, right? We're going to let it run its course. Whereas the treatment group would be the subjects who took the tablets containing zinc, because this is what we are measuring. Is zinc going to have an effect on the duration of the cold? Okay. Now, look at B. B says, to see whether regular moderate exercise has an effect on blood pressure, researchers have half of the subjects set aside 30 minutes daily for walking, and the other half do not do any walking beyond their normal daily routines. The subjects also take and record their blood pressure at the same time each day. So, treatment. What is the treatment? What are we having them do? Right? What are we checking for an effect? What will provide a cause and effect relationship? In this case, they want to see whether regular moderate exercise has an effect on blood pressure. Now, it says specifically that they have the subject set aside 30 minutes daily for walking. Walking is our moderate exercise. So the treatment is having subjects walk for 30 minutes daily. What are we checking for an effect on? Their blood pressure, right? To see if it has an effect on their blood pressure. Now, the next question says, what is the control group? Well, our control group, remember, our control group does absolutely nothing. They change nothing out of the ordinary. So in this case, our control group would be the subjects who don't do that additional walking, right? Beyond their normal routines. They're not going to change their routines. They're just going to go about their day regularly. Whereas the treatment group would be the group receiving that additional 30 minutes daily of walking. Okay, so by comparing their blood pressures at the same time each day, we would expect the treatment group to see improved results in their blood pressure let's say they take it in the mornings, right? If they take their blood pressure in the morning, we would expect to see a significant decrease of their blood pressure, right? Or a significant change in their blood pressure, as opposed to those who don't do any normal walking. All right, so now looking at C, I want you guys to read this. Hit the pause button, okay? Read C and determine what is the treatment, the characteristic of interest, the control group, and the treatment group. All right, so for treatment, we are looking for those who study for the test with a classmate, right? Or studying for a test with a classmate. Characteristic of interest would be the student's test scores. We are checking to see if studying with a classmate will improve those test scores. Control group is those who study alone, and the treatment group would be those who study with a classmate. Now let's get into evaluating media reports, okay, for statistical research. When you encounter media reports of statistical research in your daily life, for example, any TV commercials that say a certain percentage of people have benefited from taking such supplements, okay, those are statistical research. You should judge any reported conclusions on the basis of how the research was conducted. Among the questions you should consider are the following. Is the research a survey, an observational study, or an experiment? So, if you don't recall, a survey simply measures variables, like asking all of you, are you a morning person or a night person or a night owl, right? That would be measuring variables. How many of you like the mornings versus how many of you prefer the nighttime? Observational studies attempt to find an association between variables. For example, we saw a preview prior to this on drivers, right? There was this example on people driving using their cell phones. It would not be ethical to have people drive and talk on the phone at the same time to conduct an experiment, right? So that is only something we can observe. We are attempting to correlate or make a correlation between using a cell phone and driving or how people drive. In an experiment, we attempt to establish a cause and effect relationship between variables. Okay, for example, if you look up at C here, we talked about how studying with a classmate might improve test scores, right? And we can do this by having groups of people study together versus having a group of people study alone. Okay, so that's one question. Is it a survey, an observational study, or an experiment? Other questions you might want to ask yourself, was randomization used in conducting the research, right? In other words, was random sampling used, or what kind of sampling was used? And finally, does the report include the details of the research? We want to know as much as possible to how the conclusions were found, right? What kind of variables did they measure? How did they measure? What were the statistical values? So let's go ahead and look at a couple of articles here and determine what kind of research it is and if it's plausible research. So the research says caring doctors shorten and ease the common cold. Researchers have found that among patients with colds, those who gave their doctors perfect scores on a questionnaire measuring empathy have colds that did not last as long and were less severe. Empathy on the part of doctors included making patients feel at ease, listening to their concerns, and showing compassion. A total of 350 subjects who were experiencing the onset of a cold were randomly assigned to one of the three groups: no doctor-patient interaction, standard interaction, and enhanced interaction. Only subjects in the third group saw doctors who had been coached on being empathetic. So based on that little article, okay, is it a survey, an observational study, or an experiment? Well, if you go back to the article and you read this section here, they were assigned to one of three groups. That gives it away that this is an experiment. There are three groups of patients to which they are being assigned. Was randomization used in the research? If so, how? Well, if we go back here, you can see that they were randomly assigned to the three groups. So yes, randomization was used. And finally, what details of the research does the article include? Is any important information missing? Well, based on the article, if you look for important data, we have the number of subjects. Okay, so that's something. But does it give us anything aside from the number of subjects, aside from what the experiment conducted and how they were assigned, right? It doesn't give us anything. It doesn't give us any statistical values. Um, so it doesn't give us what's important, right? We know that they were randomly assigned, but what did that do for us? We are not told how patients rated the system, right? We would want to know if, if let's say 50% of people who had no interaction, right, what their statistical values were in terms of how long their code lasted compared to those that had doctors who were empathetic, right? So does it really make a difference? We don't know, right? We don't know what kind of measures were used. If you see any research that says, hey, this proves to be efficient, well, tell me how or why. Why is it efficient? What did you find? What were those measures proving that using this method is more efficient than using the other method? Okay. Example B says fitness in teen years may guard against heart trouble later. So go ahead and read this article. Okay, press the pause button. Read the article, answer the questions, and then come back and check your answers. All right, so this is what you should have. First of all, it is an observational study, right? We are comparing um, exercise as a teenager to having a heart attack later on in life. So when you think about this, we cannot create an experiment and go back and check or have them exercise in their teenage years, right? That's a little unethical. But we can observe their daily, or not their daily life, but their current situation and their heart attack risk 30 years afterwards. So we know it's an observational study. It's not a survey. We are actually measuring their health levels. Okay. Was randomization used? No, because this is taking all subjects who were males and drafted into the Swedish army. And finally, what details does it include? Well, it gives us the sample size and it includes some statistical values. However, we are missing what they define a level of aerobic fitness as and what regular cardio training is defined. For example, do they want people who were extremely fit as teenagers and would run 5 miles every day? Or do they want healthy, not necessarily fit, but just healthy teenagers who weightlifted 3 times a week, right? We don't know how this was measured. We don't know what their values are defined as. So that is definitely something to look for. We want to know, or we want a clear definition on how they are measuring these variables, and more specifically, what they are defined as. Also, we were not given any hint as to how these statistics were calculated, right? Were the statistics calculated off of a sample of the draftees? Was it calculated using the entire population of the draftees? Okay, these are important characteristics we should be looking for.